Legendary comedian Zhao Benshan suffered a stroke at the age of 52. And Gordon Liu, the actor who played the deadly scholar because of a stroke, was paralyzed for over a decade. Shitia Sheng, the author of The Temple of Earth and I, tragically passed away from a sudden brain hemorrhage at 59. Li Jingfei, who played Zhang Fei in Romance of the Three Kingdoms, also suffered a cerebral hemorrhage and ultimately did not survive. Contrary to what many of you might imagine, the #1 cause of death for Chinese residents right now isn't cancer, the disease that makes people's faces pale with fear, nor is it some colorless, odorless, infectious disease that kills without a trace. It's this all too familiar condition, one we've perhaps grown numb to: the stroke. A stroke is also known as a cerebrovascular accident. The China Stroke Prevention and Control Report shows that, on average, someone in our country has a first-time or recurrent stroke every 10 seconds. And every 28 seconds, someone dies from a stroke. Among the survivors, approximately 75% will be left with after effects, and 40% will be severely disabled. These after effects include slurred speech, paralysis on one side of the body, vision loss, difficulty swallowing, impaired consciousness, and cognitive and psychiatric disorders, among others. High incidence rate, high mortality rate, high disability rate, high recurrence rate, and high economic burden. For these reasons, a stroke is also called the disease of 5 highs. In recent years, the average age of onset for a stroke has been continuously decreasing. Notably, streamer Song Yalong, at only 36 years old, revealed that he had experienced stroke symptoms. This disease has a clear seasonal pattern, with a much higher incidence in the cold seasons. So as the deep winter approaches, we will first walk you through the causes of a stroke, methods of identification, and measures for treatment and prevention. We hope this will be helpful to all of you, as well as to your elders. As everyone knows, the brain is the most metabolically active organ in the body, even though it only accounts for 2 to 3% of body weight. Even though it only accounts for 2 to 3% of body weight. Even though it only makes up 2% to 3%. But it consumes over 20% of the oxygen in your blood. The brain's energy source relies mainly on the aerobic metabolism of glucose, and it has almost no energy reserves. So the moment blood flow is interrupted, stopping the supply of sugar and oxygen, the brain cells are in mortal danger. A stroke, also known as a cerebrovascular accident, primarily includes ischemic stroke or cerebral infarction, and hemorrhagic stroke, which mainly includes cerebral hemorrhage. Cerebral infarction is the most common type of stroke. It's mainly characterized by the blockage of cerebral blood vessels for various reasons, causing the brain tissue to lack blood and oxygen and gradually die. The specific symptoms depend on the area of the brain that's affected. If it affects Wernicke's area in the temporal lobe, it can cause problems with language comprehension. This means they can't understand what you're saying, and they don't know what they themselves are saying. If it affects Broca's area in the frontal lobe, it can cause expressive aphasia. This means they can understand what you're saying, but they don't know how to say it back to you. If the basal ganglia are affected, it can cause triple hemisyndrome, which is paralysis on the opposite side of the body from the lesion. This includes facial paralysis, tongue paralysis, and limb paralysis, as well as hemisensory impairment and hemianopia. So why is the paralysis on the opposite side? It's because the brain is divided into left and right hemispheres. The left brain mostly controls the right side of the body, while the right brain mainly controls the left side. If the lack of oxygen lasts too long, it can cause permanent brain damage and functional impairment. In severe cases, it can lead to death. For patients with cerebral infarction, the mortality rate within 30 days is about 5 to 15%. The disability rate is over 50%. Among survivors, more than 40% will have a recurrence. And the more recurrences, the higher the rate of death and disability. The good news is compared to cerebral infarction. Many patients with cerebral hemorrhage who experience severe neurological deficits can have a relatively better recovery. If blood pressure is well controlled, the recurrence rate for hypertensive cerebral hemorrhage is lower, The incidence rate is also relatively low. But the bad news is, the mortality rate for a cerebral hemorrhage is higher. The mortality rate in the acute phase is as high as 30 to 40%. After a cerebral hemorrhage, the leaked blood pools inside the skull, compressing the surrounding brain tissue and blood vessels, which can lead to cerebral edema. Because the space inside the skull is fixed, the intracranial pressure will rise. As a result, the patient may experience a severe and persistent headache, vomiting, paralysis of the limbs, and impaired consciousness. The specific symptoms and their severity also depend on the bleeding's location and volume. But what you all must remember is, regardless of which type of stroke it is, time is the key to whether a stroke patient can survive and recover. That's why rapid identification is especially important. Internationally, the F.A.S.T mnemonic is quite popular. Face. Ask them to smile. A crooked corner of the mouth or a drooping face could indicate muscle weakness. Arms. Ask them to raise both arms. If one arm is weak, it could be a sign of a stroke. Speech. Ask the person to say a complete sentence, for example. The weather is very nice today. See if the patient has slurred speech or difficulty talking. Time. If any of the above symptoms appear, call for help immediately. From the onset of symptoms, for every minute that treatment is delayed, the patient loses an additional 1.8 days of healthy life. If they can be sent to the hospital in time, doctors will use a non-contrast head, CT scan, CT angiography and perfusion imaging to confirm the type of stroke, as well as its location and size. Then it's a race against time to save as many nerve cells as possible. For an ischemic stroke, intravenous thrombolysis is currently the first-line therapy. This is done by injecting thrombolytic drugs like alteplase or urokinase into a vein, breaking down the clot that's blocking the vessel, allowing blood to flow again. If the medication can be administered within a few hours of onset, it will greatly improve the patient's survival rate and level of recovery. The longer the delay, the lower the chances. If there's a blockage in a medium to large blood vessel, a doctor might recommend a mechanical thrombectomy. That's because when a large vessel is blocked, the success rate for medication is quite low. Under the guidance of high-powered X-rays, the doctor will first puncture the femoral artery, then use a guide wire and catheter to travel all the way up the artery. At key points, an iodine-based contrast agent is used to make the blood vessels visible until they locate the site of the blockage. Finally, they use a retrievable stent or a suction system to remove the blood clot. Our lead consultant for this case is Dr. Zia from the neurology department. His social media feed is almost entirely filled with him working overtime, removing clots. He often says that if he keeps removing clots like this, someone's going to have to remove one for him someday. As for a cerebral hemorrhage, the first priority is just keeping the patient alive. Increased intracranial pressure and brain swelling are the main causes of death. So in the acute phase, the core of the treatment is absolute bed rest, aggressively controlling brain swelling and reducing intracranial pressure to prevent a life-threatening brain herniation. Dehydrating agents are the first choice, but if necessary, surgery is required, which may involve removing a piece of the skull to make space for the swollen brain, or drilling a hole in the head to drain the blood. But even the most brilliant medical expertise can't guarantee that the patient will survive. Once a stroke occurs, it's like picking up a revolver to play Russian roulette with your life. If you win, there's no prize. If you lose, it's either death or disability. Fortunately, before this losing bet begins, we still have plenty of time and opportunity to avoid sitting down at a deadly gamble. The key to preventing a stroke is to reduce its risk factors. For example, age. The older you get, the higher the risk. Or genetics. Those with a family history of stroke are more susceptible. However, these are things we cannot control. That's why it's even more crucial for us to be diligent about the factors we can control, like high blood pressure. The most common cause of a hemorrhagic stroke is high blood pressure and the hardening of small arteries in the brain. Chronic high blood pressure means blood is constantly and forcefully pounding against the walls of your blood vessels. This can cause the small arteries to degenerate or die, even forming microaneurysms and dissecting aneurysms. Building on this foundation, if your blood pressure then due to cold weather, emotional stress, or other reasons suddenly spikes, it can easily cause a blood vessel to rupture. High blood pressure is universally recognized as the single most important controllable risk factor for stroke. However, in our country, the awareness, treatment and control rates for high blood pressure are still at a relatively low level. On one hand, it's because patients don't realize the dangers of hypertension. On the other hand, it's due to the inconvenience of monitoring it. Many elderly individuals are still stuck in the phase of only occasionally getting it checked at a pharmacy. Especially now that the weather is getting colder, they get it measured even less frequently. If there were a product that allowed patients, whether they've forgotten their medication, are playing video games, watching TV, or in any other scenario, to conveniently check their blood pressure whenever they wanted, it would dramatically increase the rate of blood pressure control. And it is in response to this very hope that the Huawei watch was created. It features innovative sensor technology, utilizing a blood pressure fusion algorithm and an ultra-slim mechanical airbag. It became the world's first smartwatch for dynamic blood pressure recording, to be registered as a Class 2 medical device in China and receive CE certification from the European Union. A dynamic blood pressure recording smartwatch. For those of you who have never had high blood pressure, you probably don't know what it means. To be able to measure it anytime, anywhere. No matter how portable your home blood pressure monitor is, you can't carry it with you at all times. So when you suspect your blood pressure is high, but have no way to verify it, it often leaves you feeling anxious. But with the Huawei Watch D, everything is a little different. You're out, and you forget if you took your medicine. One quick measurement will remind you it's time. Getting worked up while slacking off at work. One quick check will tell you it's not worth it. It's just not worth it. And what's more, when you're taking a measurement, no one would even know you have high blood pressure, which greatly protects the user's privacy. Anyone with high blood pressure probably knows measuring it regularly is incredibly difficult to stick with. Just remembering to take your medicine on time is already a godsend. But the Huawei Watch D also has a scheduled monitoring function. Most people between 6 and 10 in the morning, and again between 4 and 8 in the afternoon, experience a peak in their blood pressure. We can set a reminder in each of these two windows. This line is a continuation of the previous one, and by doing so, we can greatly increase the frequency and regularity of our measurements. If you want to know your specific blood pressure peaks in order to better control them, the Huawei Watch D also supports 24-hour periodic blood pressure measurement, also known as ambulatory blood pressure monitoring. Users can, based on their needs, set the time interval for the measurements. This way, it not only helps us find blood pressure spikes at specific times, but it also allows us to evaluate our blood pressure situation during the night, fluctuations throughout the day, as well as salt sensitivity and so on, for a more accurate and comprehensive assessment of your blood pressure risk. The measurement data can be shared within your family group, so even if you're thousands of miles away, you can still check on your family member's condition. As we all know, the elderly, much like children, don't always follow advice. If a friend wants to take a measurement, you can have them use the guest mode, so it won't interfere with your own blood pressure records. However, blood pressure measurement is just the tip of the iceberg of this watch's features. The Huawei Watch D also supports sleep, SpO2, and all-day monitoring of multidimensional health data like your pulse. It also has a one-tap mini health check feature, which can instantly measure your blood pressure, heart rate, stress levels, and more, evaluating 11 data points, helping users discover potential risks early. And the battery life is incredible. You only need to charge it once every 6 days, continuously safeguarding your health. Beyond just monitoring, we have to properly manage our blood pressure. In the winter, blood vessels constrict in the cold, so blood pressure will be higher than usual. People with blood pressure problems should pay attention to staying warm and protected from the cold, and also be mindful of temperature changes. Of course, there's also losing weight. quitting smoking and alcohol, exercising consistently, taking medication regularly, getting enough sleep, improving your diet, and avoiding emotional agitation. Remember, after you've developed the 3 highs, these are no longer called lifestyle improvements, but rather a survival guide for chronic illness. Now, the most common cause of cerebral infarction is atherosclerosis. Those of you who regularly watch our videos should already know. This is when yellowish porridge-like lipids accumulate on the inner lining of the arteries, causing the arteries to narrow or become blocked. If the plaque is stable, that's one thing, but what's really scary are the unstable, vulnerable plaques. Once one ruptures, a blood clot can form in an instant and block the vessel, cutting the patient's life short. So what factors are associated with atherosclerosis? High blood lipids, especially having high low-density lipoprotein. And then there's high blood pressure, diabetes, smoking, obesity, alcoholism, and so on. There are also cases where the cerebral blood vessels themselves are fine, but a blood clot from another part of the body travels through the bloodstream into a cerebral artery, causing a blockage. This is called a cerebral embolism. Among these, atrial fibrillation is the most common cause of cardiogenic cerebral embolism. When atrial fibrillation occurs, the atria can't contract properly, causing the blood flow to slow down and stagnate. This allows platelets, clotting factors, and fibrin to stick together and form a thrombus, which then travels with the blood to the brain. High blood pressure is the cardiovascular disease most likely to be complicated by atrial fibrillation. On a side note, Huawei watches also support alerts for atrial fibrillation and premature beats. I, for one, after pulling some all-nighters for work these past 2 days, also got alerted to a few premature beats. I don't dare squander my health anymore and have been going to bed early. The truth is, cardiovascular and cerebrovascular diseases are far more terrifying than we imagine. Their horror doesn't just lie in the fact that they consistently rank first or second on the list of killer diseases, but in that, most of the time, they are controllable. The problem is, many patients always interpret controllable as not a big deal, until they have a stroke or a heart attack, suffer from kidney failure or blindness. They always feel the 3 highs are just an empty threat. I have too many friends whose parents refuse to face reality until it's too late. Young people are a bit better because they tend to cherish their lives more. So if you have the chance, try to reverse manage your elders, especially this winter during this spring festival. Get them to quit smoking and drinking, control the 3 highs, exercise moderately, and improve their diet, even though they most likely still won't listen. And many of you watching this right now don't understand why we have to keep nagging about these things over and over again. Actually, not understanding is a good thing, because those who do understand might no longer have the chance. So, try one more time. Nag your elders one more time, because those who understand might no longer have the chance. So try one more time. Nag your elders just one more time. Maybe then there'll be a little less regret in the world. Alright, that's all for this episode. If you enjoyed this video or found it helpful in any way, consider following us. That way you can learn even more medical knowledge